Welcome back to the morning show here on Arise News.
According to the latest biannual economic report of the World Bank's Bretton Woods Institution, Nigeria will overtake India as the nation with the highest number of infant mortality under the age of 5 by 2021. Joining us to speak on these latest statistics and what Nigeria needs to do differently to prevent this is Dr. Ejike Oji, the chairman of the strategic management team of the Coalition for Maternal, Newborn, Child and Adolescent Health Accountability. Mr. Ejike, welcome to the morning show.
Good morning. Thank you for joining us today.
Good morning, viewers.
Now, talking about this report, the report did mention that the infant mortality rate is slowing down. However, we will take over India in 2021. What's responsible for this?
Yes, if you look at the investments that we are making in terms of our population, we are not making enough investment in the healthcare sector. I'll give you an example. In the year 2001, there was a big meeting here in Abuja, and it was a declaration, they called the Abuja Declaration, where all the states that belong to the African Union, and which was chaired at that time by our own president, Olusegun Obasanjo, they made a decision looking at how things were going in the African continent, that every country should go back and make sure that the annual budgets of those countries, that 15% of it minimum, not maximum, 15% of that should go to funding healthcare in the country. And that meant that if you do that, then there will be a reasonable healthcare, should I say, for your citizens. In Nigeria, since that thing happened, the highest we have ever gotten was 6%. Currently, the last annual budget, only 4.23% of our budget was dedicated to the healthcare sector. And then in terms of actual quantum, or should I say actual value, even though there is some level of increase in terms of Naira value, but if you now denominate it to the dollar, the last year's budget was just about 70% of what we spent about 2007. So you could see, even though the amount of Naira that was going up, but in terms of dollar, it's come down because of the devaluation that happened over the way. But most importantly, the thing that is actually driving most of these poor indicators that we have is our population. In 2006, Nigeria had a census, and we said we were 140 million. Between 2007 and 6, and now, I have, in my work, anytime I see a gathering of Nigerians that are up to 100 and above, I make it a point to say, in the last census, were you counted? And every time I do that, minimum 30% of people in that gathering said they were not counted. Yet we said we were 140 million at that time. But the current National Population Commission estimation of our population is 198.5 million. So that means we added 58 million new mouths to feed within a space of 12 years. Even if we had the best plans and everything, the population is increasing so rapidly that it outstrips all resources, and it will outstrip all projections of making sure we feed our family and provide adequate health care. So you could see, in terms of context, in terms of content, in terms of volume, even if we plan for the population that we have, it's going to be difficult because our resources are also dwindling. Remember that our money we get is tied to the oil prices. As we speak, the oil prices are coming down, so even the expected revenue the federal government said they will get, they didn't get. So, years for years and end, almost 12, 13, 14 years, some of us in the civil society movement in terms of healthcare had been advocating that we put aside at least 2% minimum of our consolidated income to funding healthcare in the country. It didn't happen until in the twilights of the Jonathan administration. Barely 3 to 4 months before that administration came to an end, they signed it into law. And since then, we've been also working with the new government, and last year, we were happy on the last fiscal year, for the first time, that act was cash-backed, even though the Parliament reduced the 2% that we had suggested to 1%. And then so now we have at least 45% of that money should go directly to the primary healthcare centers. And 50% of the national health insurance came to fund the underreached and pregnant women. And then also 5% to the basic emergency fund that will go to the Federal Ministry of Health. So what I'm trying to paint here is that the volume, that is the quantum and the quality of healthcare that come to Nigerians have gone so down that WHO recently said that our healthcare system ranks about 189 over 191 globally. So we're only better than DRC, Congo, and Myanmar. Myanmar is the former Burma, where you have the Rohingya Muslim issue right now. So you can see that the attention we're paying to the healthcare is not so good. And that was comes specifically to infant mortality.
Doctor,
Yes.
can I just take you back to clarify?
Let's
You made a brief reference to the Basic Healthcare Provision Fund, which was launched this year by the National Assembly, which the National Assembly then allocated 1% of the Consolidated Revenue Fund. Do you have the specifics now? Because Arise has reached out to the Minister for Health, Mr. Adewale, several times to find out the status of the BHCPF, whether the money has been released in compliance with the Appropriation Act of 2018. Are you aware of the funding status now?
Yes, I was even with the minister last week because as I speak now, we are in the middle of our family planning conference, which speaks to some of these issues. I'll mention a bit about it later. And then the minister had to go for a meeting. There is a committee that has put together to be able to address how the money should go and how the country will make sure that the money is made properly use of. So this was just last week, and then we're going to see the minister next week, and then we'll get a proper briefing because he knows that all of us are interested because we all fought for that fund. And then we'll seek to make sure that the funds are properly utilized for the reason that the money was made available. So I think by next week we'll get a proper picture, but I can tell you the minister had put a committee together to make sure that that fund is properly administered.
Doctor, let's talk about immunization. This report also highlights the role of immunization, which is the basic and safest way to prevent, child mortality. It says that immunization in Nigeria, despite the many policies of immunization we have, seems to be falling really short. In West Africa and the sub-Saharan region, and in the country, it says, in fact, the northern region has fallen really short. What is your take on this?
Yes, you remember a few years ago, we made a lot of progress, and I think one of the very recurring bad decimal, if I use that word, is the coverage for especially something like polio. The insurgency in the northeastern part of the country made a mess of all the gains that Nigeria made in terms of making sure that all Nigerians, young Nigerians are immunized. And once we belong within the same ecosystem, once you have a problem in one part, it can spread very rapidly. But I still go back to the issue of funding because the philosophical issue here is that we're not putting enough into funding our healthcare. By 2023, as you know, it's a Gavi Alliance, a cocktail of donors that are supporting us in our immunization. In the last fiscal year, we put about 9 billion naira into the immunization process. That's by 2023. Nigeria will be needing about $620 million yearly, $620 million yearly to make sure that every child is immunized in the country. So the problem here is funding again.
All right, Doctor.
And then that's why tied to the funding is the population. We have our population growing rapidly, and that's why if we do not reduce our fertility rate, reduce the absolute number of people coming, it's going to be difficult for us to meet our goals.
All right, Doctor. So for the benefit of our viewers, what are some of the causes of, maternal mortality, yes, infant mortality rate in Nigeria. I know like cases like the sudden infant death, people are not even really aware of it, because I know when I was in America and I had my, my prenatal assessment, they will teach us on how to really take care of our kids and not, you know, mothers are not allowed to sleep with their babies because of that. So tell us some of the causes of the sudden death for the mortality rate in Nigeria.
Okay, we are talking about two key issues here, maternal mortality and infant mortality. Let's start from maternal mortality. There are 5 major causes. Yes, there are 5 major causes of maternal deaths. One is postpartum hemorrhage. That means the woman has delivered, the placenta is out or the placenta is stuck, and the woman will continuously bleed and bleed to death. The second one is complications of unsafe abortion. Because of our abortion law, most women who have unintended pregnancies and don't want to keep them will go to quacks to get it terminated, and they end up with complications that will either take their lives or maim them. The third one is eclampsia, that is hypertensive diseases in pregnancy. And then the fourth one is obstructed labor. The birth canal is too narrow for the baby to be able to pass through. The woman will labor, and the uterus will rupture, and she will die, and the baby will also die.
Correct.
And then last is overwhelming infection because of unsaturation. So if you look at all of this, the skills attendant delivery, if you look at the last NDHS, you can see it's come up a little bit. It used to be 33% to 35% of our women nationally have access to skilled attendants birth. And I can tell you all the maternal deaths you see come from maybe 6 to 7, max 8% of all deliveries, because delivery is a physiological, natural process. It's only in a few cases that it gets complicated. But the important thing is that if there's no skilled attendant at the time of delivery, the woman will get into serious trouble. So the midwifery service scheme was introduced years ago. We were part of conceptualizing it. And I can tell you when it was fully implemented, it reduced maternal mortality by almost 40%. But unfortunately, that scheme is not being properly funded. So that's why maternal mortality came down to about 447. Now it has gone up a little bit to 576 as we speak. So it is also not funding directly the primary health care centers where our women go for delivery. And that's why we are all interested in this National Health Act, because it will seek to fund healthcare systems where the women go to provide antenatal care and delivery services free. And then the maternal death is also tied to infant mortality. In fact, once a woman dies, the chances of the under 5 to survive is reduced drastically. In fact, it's 5 times. When a woman dies, the child that she left behind has 5 times propensity to die than compared to a child that has the mother alive. Mm-hmm. So you can see there is a direct correlation or direct relationship between maternal deaths and infant deaths. And then the sudden death syndrome you're talking about is a lot of women, because some of them are primips, some of them are inexperienced, and like you say, there hasn't been proper antenatal care and tutelage, right, and there's no good postnatal care services. Right. So those are the things that are making, so they are not even told and shown what to do. Some women, their children might even go hypoglycemic because the child probably will be crying, hasn't fed, they wouldn't know the child is not feeling well, or the child is even wet and might not want to suck, a child is just uncomfortable, and they wouldn't know that if a child doesn't eat well within 24 hours, that child can go into a hypoglycemic shock.
What about
and
the
then
causes of the infant death? What about the cause, because I asked you questions.
Yeah.
What about some of the causes for the infant death rate?
Yes, that's what I'm saying.
Okay.
I just mentioned one of them. Mm-hmm. And the other one could also be the child has taken and aspirated.
Okay.
And then would aspirate. The other one is pneumonia. Pneumonia is one of the major causes of bronchopneumonia, because bronchopneumonia happens in the 2 extreme ages, either too young or too old. The other one is also diarrheal diseases. One of the key things that kill young people is diarrhea. And that's why women are taught to use oral dehydration therapy. And these are the things that are taught to women when they have their postnatal clinics. Mm. So the other one is when you have immunization not properly given to children. I think we've mentioned polio before.
Yes.
You can have bulbar polio, which will kill the child because of respiratory failure. because the polio would attack the area that controls respiration in a child. Okay? And then, of course, malnutrition. UNICEF came out with a report some time ago that 30% of Nigerians are malnourished. And not only that, the greatest tragedy that will happen to Nigeria is that about 30% of our children didn't have their brains well developed. You know, the brain of a young child develops within the first 1,000 days. Anything after that, if there wasn't proper nutrition for that brain to develop, you have a child that has less intelligence quotients. And then that child would live with that for life. Somebody said something that very, very interesting yesterday in our family planning conference here in Abuja that is happening at the Sheraton. He said, do you know, because of the infant malnutrition that we have, that it takes 5 times explanation, 5 times or repeated explanation for an issue for a child to understand it when a child is brain stunted. So right, that means we are going to deliver in a generation of Nigerians that are not their brains are not properly developed.
Doctor,
so
let me just draw your attention to
key things,
something very key as we actually press it further. Of course, prevention, a lot of prevention has to do with sensitization. What's the level of sensitization on the parts of the mothers and also on the general public in helping reduce this infant mortality that we're talking about right now?
Yeah, we don't think enough is being done, and that's why we are the Coalition for Maternal, Newborn, Child and Adolescent Healthcare Accountability. Part of the thing we're doing is to make sure that we hold governments accountable to make sure they properly budget. The budgeting process at the federal level, we are very, very key. We are part of civil society support group that is supporting the National Assembly in terms of making sure that appropriate resources are put into the budget. We follow the money too, to make sure that when the money is also appropriated, it is released and is used, especially at the last mile. The second thing is that we are also developing advocacy working groups in the states. We call SLAM, state-level advocacy working groups. And what they are doing is to also do the same thing we are doing at the federal level to make sure money is put in place and follow the money and hold governments at all levels accountable. But I want to say this very quickly and very emotionally too. Not much is happening at the sub-national level. And you know, health is on the concurrent list. The federal government cannot prescribe to the states on what to do when it comes to health. They can only advise on policies and guidelines. So we want to use the opportunity to urge the state governments and the local governments to invest much more. And then I can tell you, one single bullet that can reduce maternal mortality, reduce infant mortality by projection is appropriate contraception. Nigerian fertility rate is about 5.5. We just came back from Kigali, International Conference on Family Planning. Our neighbors, Burkina Faso, above Nigeria, is 4.2. Bangladesh is about 168 million like us now. Their fertility rate is 2.2. And then if you come to Nigeria, there are great disparities. And if you follow the regions where we have this high maternal death, high mortality rates, it's also tied to high fertility rates. In Nigeria, in the south, it's on the average of 4.2 to 4.3, whereas in the north, it's as high as 7.1. And if you follow where are most of these deaths happening, they are happening mostly in the northern part of the country because of the high fertility rates.
All right, so Dr. If you had to break it down to the layman, these numbers you're throwing out, what does it mean to the layman? 7.1, all right, equate it to what it is. How would we interpret these figures?
What I'm saying here is that when you say the fertility rate is 7.1, maybe you should ignore the 0.1. It's just saying that the average woman around that area says that they want to have 7 children. And they go ahead to do that.
This is a hard
And then for the people that say it's 4 points, that means the average woman in that region says they want to have 4 children. And they go ahead and have it.
This is a hot button debate.
You remember, if you look at...
Doctor, you've talked about reducing, in your words. You said we have to reduce our population, is what you said earlier. People argue that, is this a function of the population or a function...
Population growth.
Population growth. People argue, is this a function of the the population, a function of governance. When you have infrastructures not being put in place, increased poverty, shouldn't we be fixing the problems rather than telling people how many children they should have and reducing the number of children they should have? That is one. Looking at this report, it also says that the rate of child mortality between the ages of 1 to 5 is 8 times higher among poor people than it is with the richer people. Is it a crime to be born poor in Nigeria?
Let me take this in 2 parts. Let's address the issue of population reduction or not. No matter what you do, no matter what services you do, or no matter how good your healthcare system is, if you do not reduce your fertility rate, it will not work. There is a phrase, demographic dividend or demographic doom. Nigeria is at a crossroad now. Nigeria can either use our population as an opportunity now, or it will be a curse. And I'll tell you how it works. Globally, all the countries that have met prosperity went through what we call a demographic transition. And how it works, there are 7 key things that have to happen when you are the way we are now, with 60% of our population below the age of 30. 45% of our population is below the age of 15. And in terms of population dependency, we describe a dependent population for a population from 1 to 15 of age. Those are the dependent population. That is in developed world. In Nigeria, even 30-year-olds are still dependent on their families. So you can see there's a burgeoning high population dependency in Nigeria. And then how this works is that if you want to turn that population into prosperity, there are 7 key things that must happen. Number one is reduce death rates. Number 2 is to reduce maternal mortality. Number 3 is to invest heavily in your healthcare sector to improve the health outcomes. Number 4 is that you must educate that burgeoning population with adequate and relevant education. Number 5 is that you must create an environment that will make sure there will be jobs for those people. Because how it works is that if every young child in that bracket of population starts earning an income, as they earn income, they save. As they save, they will be able to buy goods and services, and they will expand the economy. Then the final thing a government must do to be able to get into that transition and go to dividend is that there must be equity, there must be justice, there must be a sense of safety, a sense of belonging of citizens to their country. I keep referring back to Kigali. We just came back from Kigali.
Doctor, I'm sorry to interrupt.
It was a wonderful surprise to all of us.
Doctor, I'm sorry to interject you on your trip back to Rwanda, but just to round up quickly, you've highlighted the role of funding. You've highlighted the role of overpopulation in this issue. Can you just provide for us the roadmap to quality free healthcare to Nigerian children under the age of 5, given that it's not about funding all the time? Sometimes, even when funding is provided, how is it used? How can we be more efficient? How can our traditional birth assistance be regulated? What is the roadmap to what we're trying to create?
The roadmap is, first of all, we must invest massively in contraception. Women must plan their families and have children they can take care of.
Birth control, number 1.
And we must follow their natural course.
Right.
Yes. Number two is that we must invest in immunization and make sure that every child is properly immunized, because it's one single bullet to reduce maternal infant mortality. Number 3 is that we must bring in a robust healthcare financing system. No country can spend money out of pocket and get good healthcare. So our health insurance must be revamped, that every Nigerian, if possible, is covered. Imagine where you tell every adult in Nigeria, call it 100 million or so, to pay just 200 naira every month, and it is properly and efficiently used. Number 4 is that in terms of women, they must have skilled attendants anytime they want to deliver. And before then, they must be properly passed through a good antenatal care services and postnatal when they have a baby. If we do all this, I think we'll reduce the maternal mortality and infant mortality that we have in the country.
Well, thank you so much, Doctor, for joining us in our Abuja studios there. We really appreciate all of your insight here. It's time now for a short break on the morning show.